Don Lloyd,
Yes.
thank you for joining us for this conversation. I'm actually really excited to have you with us because you're bringing a representation from rural healthcare into this conversation. And we generally think of these as some of the least innovative institutions, not because they aren't endeavoring to be, but because we just find that the technology isn't reaching them as quickly as like the major metropolitan centers. What have you guys found is the case? Do you feel like you've been able to keep up, or has there been challenges? What does that look like for you?
You know, we don't have the capital resources that large health systems do. And in our particular case, we're not a member of a system. We're a standalone independent,
Sure.
a dying breed, if you will.
Yeah.
And so, and we have a payer mix that is quite challenging.
I see.
And so we're in a perpetual state of innovation on how can we continue to enhance the quality of the care we deliver, but also maintain a margin to reinvest into operations. And so, you know, we don't have resources to go out and heavy load back office functions or even clinical functions.
Yeah.
And so we try to find new and different ways to accomplish that with the strategic goal to perpetuate the mission.
So to be in, I think your words were a continuous state of innovation, almost sounds like a culture of innovation.
Yes.
Tell us, how do you foster a culture of innovation?
I'd love to tell you it was great leadership, but the fact of the matter is that the pandemic kind of kicked us over the starting line.
Oh.
In response that, you know, we had to innovate to survive.
Yeah.
And so, at least in the Commonwealth of Kentucky, in that circumstance, when the state shut down and the spigot was shut down,
yeah.
We had two crises. We had a clinical crisis we knew nothing of, and we also had an economic crisis.
Yeah.
And so we ran parallel disaster response functions.
Yes.
And that taught us to be very, very creative.
Yeah.
And it also taught us that, you know, by taking risk, calculated risk and chance, that began to transform and embed itself within the organization. As difficult as those times were, in a unique way, the pandemic actually helped us foster innovation as a matter of survival.
Yeah, so, yeah, sort of innovation by necessity, right?
Absolutely.
And it seems to me like collectively, healthcare sort of surprised itself in some ways with how quickly it managed to address some of the critical issues that came up. Did you guys surprise yourselves?
We did, but we also had some help that, you know, we have to really acknowledge.
Yeah.
And that, you know, whether at the federal level or at the state level, a lot of the regulatory inhibitions to innovation that restrict us,
yes,
either from a regulatory or an accreditation perspective, those were suspended. So it enabled us to do things without compromising care, but to think really outside the box.
Yeah.
And then it also enabled us to collaborate with people differently than we've ever collaborated. And they brought a sense of innovation to us in terms of quick development and R&D. You know, we had a plastics manufacturer create safety devices for resuscitation of patients,
sure,
and they taught us a thing or two. We had a military contractor helped us develop a Wi-Fi network
yeah,
in our outlying post up in the hills and hollers of eastern Kentucky. And we learned from engineers that we typically wouldn't have worked with in specific ways.
So you had, it sounds like, success working and innovating with outside organizations. You mentioned a couple of the partners you were working with, technology partners. How about internally? Did you guys have any, you know, when you had like build versus buy decisions, you have to undertake innovation internally. Right. What did innovation look like internally?
You know, we're a teaching institution,
right,
so we have a cadre of learners that are there all the time. And one of the things we've been working very hard on is to make sure that we're building research techniques into their curriculum and training.
Yeah.
And so we use students and of all kinds, undergraduate students, graduate students, residents, fellows, and we allowed them to lock themselves in a room and to find solutions to things, whether it was how are we going to manage capacity overload, or how are we going to get vaccines and testings to the most remote areas, within an hour's drive of us up in these extreme, very remote communities.
So this sounds like a really powerful idea. So is it kind of like, is it a skunk works in that they're enabled to actually to put these things in, implement them, or is it really kind of a think tank where they're coming up with ideas and then handing them off to others? What does that look like?
No, their charge is develop,
wow,
and then implement as quickly as we possibly could, because speed was a necessity at that time. And so a prime example was a group of students and residents and a couple of attending physicians locked themselves up in a conference room at 3:30 one afternoon and came out at 8 o'clock that evening and said, we have a solution to our capacity problem because we couldn't shut the facility down. There was no other place for those patients to go. And we are 60 miles from the nearest hospital, 65 miles actually, and they were full too. And so we had to care for these people. So they created overnight, or that afternoon, a COVID care at home program with using roving teams of multidisciplinary medical facility clinicians and others. And we accepted our first patient at 8 o'clock the next morning.
Whoa!
So we learned in that quest that we not only could develop very quickly, we could implement very quickly.
I'll say, does this team have a name?
No, we didn't think of that at the time,
Okay, so you obviously deployed this tactic, right? Where you're tapping the fellows, you're tapping the residents, you're tapping the students, you're putting a collective brain in place charged with actually implementing solutions. Super powerful concept. You used it in a crisis mode. Are you still using this strategy?
Yes.
Tell me what they're doing now.
Well, right now, we have a finance team that's assembled that is chasing every potential governmental, federal and state a program that could enhance the work that we're doing to better prepare for, hopefully not, but the next pandemic. And so we use the same idea and the same model, is lock a group of creative people into a room and said, this is what you need to do. You need to find $10 million worth of grant funding somehow.
And you can only come out once you've done
That's right. Well, we're not that extreme, but they did, and they've been quite successful. Since the pandemic started, we've probably been the recipients of almost $15 million of grant funding.
Have you been a speaker at this event?
I spoke a little earlier, not on this topic.
Well, this seems like a very important topic to be sharing on. I mean, I would imagine many other health systems would love to learn about how you've accomplished this. Do you have you used any platform to share this information?
Not just within the Commonwealth of Kentucky, and then of course a lot of my executive team. We do guest lecturing and teaching at local colleges and with medical students, and so we share some of that learning and those experiences. Not every project we tried, was as successful, but I think one of the values to being able to take that risk, though, is it taught us that failure is not necessarily bad, and that we just regroup and we develop courage in our assessing and monitoring the effectiveness of our project designs. And not only were we moving fast, we were willing to scuttle a project fast too if it wasn't working. So
it sounds like you've created both an environment and a discipline for innovation inside St. Clair, right? The environment meaning it's safe to fail. In fact, you can learn from that. You're gaining out of that. You created a mechanism to put ideas, to implement ideas and have a feedback loop, and then to quickly transition if that's necessary. And then this process of the think tank, I mean, those two things, the environment and the process really coming together has been very powerful. Did you guys approach that with intent, or was it just kind of ad hoc and it came together? Now you have this miraculous machine.
Yeah, no, it just developed.
Wow.
And over time, while when you're in the weeds, you don't necessarily see the big picture. And then, we had successes in the unexpected places that made us kind of reflect, well, how did we achieve that?
Yes.
And then we began to put two and two together, and then we had people that traditionally don't participate in those kind of innovative processes come to us and say, hey, I would like to try to solve this particular issue. And so then we realized we were affecting a cultural change in the organization. It was initially, as I stated, it was about survival.
Sure.
And then now it's just would kind of become part of our culture that we'll take calculated risk and we'll allow people to innovate and be as creative as we possibly can.
I really hope this spreads. I mean, you think about the disciplines that exist in, say, like Silicon Valley. I mean, these are exactly the disciplines of Silicon Valley, right? But you guys have employed them in a healthcare context, which is unfortunately rare to see that it's deployed in that context.
Yeah.
So I'm fascinated by what you've been talking about here. So what I would say is, what I would ask is, what guidance would you have for other health system leaders from maybe not having approached this with a process, but now seeing it, as you said, from the 30,000-foot view, you have this machine in place. What guidance can you give other health system leaders to benefit from a similar system?
We've traditionally been what I call a stoic industry, right? We like our comfort zones, and I think one of the things to be successful in affecting this kind of cultural change is that you've got to get uncomfortable. You have got to trust people that they're going to do the right thing ultimately for our purposes to take care of people and to advocate for those people. And they may come up with a methodology or a manner that is not very non-traditional and way out of the traditional expected mindset. And you have to if you ask people to be creative, you have to let them be creative. And so, I've been doing this a long time, almost 40 years.
Yeah.
And, it's hard to change my spots, if you will, after 39 years of learning.
Yes.
And so I got way out of my comfort zone. And my advice to other leaders is trust your people. Mm-hmm. Let them innovate, but let them fail too. It's not the end of the world, and we found that we learned as much from the failures as we did from the successful project.
Yeah, amazing. So we've talked about the strength of your innovation structure and processes internally. But you also mentioned early on you were working with some vendors, right? Some partners, I'll call them partners. Do you have guidance for how to get the most out of engaging partners, maybe guidance on how to find partners and how to engage them in effective ways? What did you guys do?
I think from a normal operating perspective, and really from a strategic performance improvement perspective, whether it's clinical or it's financial or it's some other operational paradigm. We, especially an institution of our nature, we just don't have a deep bench depth, and we don't have resources. Sure. So you've got to be very selective and deliberate about working with your vendors, and then. Like we did with our own internal teams, with your vendors, you have to trust them and you have to let them innovate. They need to understand the culture you're trying to create.
Sure.
And we had some success in particular on the financial side,
Yep.
working with collaborative partners that to this day, they've been our partners since the beginning of the pandemic,
Yeah.
and to this day, post-pandemic, they're right by our side.
Yeah.
And we've been able to demonstrably show the ROI on that kind of collaboration.
Right.
And it's strengthened our organization so that we can actually take more risk now.
Yeah.
That living life, while it's still a challenge in this crazy economic environment,
Yes.
the truth of the matter is that we've strengthened the organization in the process, both financially, clinically, and operationally.
Wow. You've talked about risk and you've talked about failure, and you've been at this for 40 years. I'd be curious to hear from you if you have thoughts to share about some of the pitfalls that you've encountered so that other health system leaders who are, I'm sure, would be eager to follow the guidance that you've already provided, because again, the system that you've created sounds incredible, but they're likely to encounter their own, right?
Yes.
Failures.
Yeah.
So maybe you can kind of give us a little forecast and previews of challenges to come.
Yeah, we had, I would say 3 in particular.
Okay.
Failures is that we've got to recognize in a fast-paced, innovative environment,
Yep.
even on a small department-specific basis, that you've got to watch for resiliency among the teams that are doing this work. Because it becomes all-encompassing to them, and they're very determined to see the project succeed.
Yeah.
And there's an emotional drain that occurs as a result of that, especially if the project doesn't quite achieve.
Yeah, sure.
And we experienced that on a number of occasions. I feel that we were too slow to recognize the lack of resilience, right? And on another side of the equation is that you've got to maintain operational discipline in a culture of innovation. And you know, that's a challenge today, especially in this inflationary environment that we're in. And there's a lot of other noise that's impacting operations in our business today, especially at the height of the pandemic when there was tremendous amount of money being floated into the health system.
Yes.
Well, our perspective is that's gravy, right?
Yep.
And so you still have to manage to your normalized net revenue. And there were times where we applied those funds as they were intended, but we lost discipline in the process, and we had to kind of retrospectively pull our organization back to the traditional disciplinary controls that you have in ops.
So it's resilience, right? Being aware of resilience, and then maintaining operational discipline.
That's correct.
Fantastic. If we're going to zoom out, we're going to look at American healthcare from the 30,000-foot view.
Yeah.
In the context of a conversation about innovation, where does our system need to go next?
You know, there's been incredible technological innovation, but we're still resistant to some of the retail innovation that we see in so many other industries.
Yeah.
We're still a terribly cumbersome and slow healthcare industry. And in many organizations, there is this institutional resistance to change. And we've just got to get over it if we're going to be successful. You know, the trade press recently has published a lot of articles and research about the fragility of our health system.
Wow.
And it's not just rural America, it's urban and it's suburban institutions. And, you know, unless we become more responsive to ultimately the people we take care of, in that we meet them on their terms instead of ours, you know, I think we're in for a rude awakening as an industry.
Yeah, and what I'm hearing when you say that is we're talking about the fragility of brick and mortar healthcare.
That's right.
And I think of, when that comes up, now I'm thinking of Amazon, I'm thinking of CVS, I'm thinking of Apple.
Yeah.
These are organizations angling for their slice of the pie, so to speak.
Yeah.
Do you guys have that sort of in your peripheral? What are you looking at as these classically technology companies or retail companies are really trying to capture their share of that landscape?
Yeah, you know, we can't ignore that just because of our geographic location. And so we're trying to be proactive in the market, be first to market with very consumer-centric, friendly use of technologies, whether that's for access or it's for treatment. And
or billing.
But exactly. And there's some incredible tools out there today that can be adopted that are much more consumer-centric. And I'll tell you, we did learn another lesson.
Yeah,
is we adopted on the revenue cycle some apps that made not only payment, but scheduling and other access into our system much more convenient. And just as it's a 2-click purchase on Amazon, you know, we have to get to a 2-click access and payment methodology if we're going to be successful, because the Amazons of the world, or the CVS Health, or Walgreens, you know, pick your poison. They're going to eat our lunch if we don't jump out on the innovations. Now, will that look different for each of us? You know, obviously we'll have to do it to scale.
Sure.
But we have to be proactive about that, and I think that's part of that forced change that our industry is coming to reckon with at this time.
Yeah, what I love about this is we're talking about the 30,000-foot view, as we're seeing it from a whole. What we actually ended up doing is we're really looking at the singular interaction of the consumer. I mean, that's what you see when you're at the 30,000-foot view, is that it's actually, let's come back to that singular interaction of the consumer, which is like, it's a fascinating dynamic between the two of those.
Yeah. You know, we recently opened up our first urgent care center, right? And we opened it up in a temporary location because we were trying to be first to market, because there was some competitive activity that was encroaching our primary service area. And we went in with a traditional pro forma development, but we designed the service delivery totally out the box. It looks like a hotel lobby when you walk in. There's no waiting. There's no seating. It's because we're very, very diligent about the patient pool.
Yeah.
The patient pool, right? And we're having capacity issues now because the project was so successful. We're seeing 4 times the volume 6 months in that we expected to see at the end of the first 12 months. And so we're having to move rapidly like some of these interrupters are, to expand additional capacity and to grow. And that creates its own operational and strategic challenges. But that's the fun kind of part of the work right now. When you create that culture of innovation and excitement and enthusiasm, you know. And so what we're working on is a second potential location right now. And we find a group of very crazy, innovative people that it's all about the patient and the customer. And we're even changing our vernacular. And you know, traditionally in medicine we always talk about the patient, right?
Yes.
The truth of the matter is our patients are acting like consumers.
Yeah.
And so they are consumers, and we have to respond to them as such.
Yeah. This is absolutely fascinating to me. The amount of innovation, the processes that you've created, the culture that you've created, the environment that you've created for innovation, it's so encouraging, honestly. I mean, it makes me feel very positive about the future of healthcare. So I've driven this whole conversation, obviously, with my own questions, but Don, I have an instinct that you have so much more to offer us, and we're just about out of time. So I want to make sure that if there was something that you could have shared in this conversation that we didn't get to because I didn't ask the right question, while we're in this discussion about innovation in healthcare, is there anything else you want to share?
Yeah, you know, with respect to innovation in healthcare, I think the next frontier for us is care delivery redesign. And you know, we have tremendous issues with the availability of clinical resources and non-clinical resources today. And we're going to have to think very innovatively about how we redesign care.
Yeah.
And it may not use the traditional clinicians that we have.
Right. Yeah.
And you know, on a smaller scale, we learn that we can use technology to substitute for on-site medical exams and create very efficacious results with the patient population and drive patient satisfaction up, right?
Yes.
So we're going to have to figure out how we do that, for instance, in critical care.
Yeah.
And, you know, there was a model that we learned from during the pandemic. And during the height of we call it the Delta surge, the fourth surge. We were at 138% capacity and just overrun.
Yeah.
And the governor and our legislative delegation sent us two FEMA emergency response teams. And those two teams came in very unconventional mix of medical professionals managing acutely critically ill patients. Yeah. And they were able to accomplish with the same or better outcomes that we did. A team of 15 was able to accomplish what it takes 37 FTEs under the conventional delivery model that we use.
Yeah.
And so we're trying to perfect and identify ways, and it requires a lot of bits and pieces of moving parts.
I just want to express, honestly, gratitude for the work that you guys are doing, that you're leaning into innovation. It sounds like, frankly, leading innovation for American healthcare. I am so glad you spent time with us today. I think what you've created needs to get visibility, and that you're taking time to share what you've created, I think, is a benefit to the entire industry. I hope you continue to do so, whether it's through Becker's or other organizations. I think your story, what you've created, how you've created it, absolutely needs to be told.
All right, well, thank you
for coming by.
That's a pleasure.
Yeah, this
has
been a really great conversation for me, too.
Yeah, thank you.